In the first few sessions, Teo seemed uninterested in interacting with me or even in acknowledging my presence. I felt invisible in the room with him, especially when I actively tried to draw his attention by calling out his name, but there was no response. In the hope that perhaps art materials would evoke some curiosity in Teo, I laid them on the floor for easy access as opposed to a chair and table that could be more restrictive. However, Teo was not drawn to them. As mentioned earlier, Teo probably did not feel secure in a new environment and felt safer within himself instead of opening up to unfamiliar and unpredictable input. Considering Teo's mother had warned me of his lack of reciprocity, I should have been prepared for his aloof behavior, but I began to panic, possibly because I too did not feel safe with him, not knowing how he would respond to me, if at all. While Teo walked back and forth along one wall of the room, grazing it with his shoulder and singing nursery rhymes, not paying any attention to the art materials that I had hoped would catch his attention, I moved on to playing drums and mimicking his songs. Teo remained oblivious to my overtures. Eventually, I began engaging with the art materials myself, learning to hold back or not engage actively with Teo until he was ready to interact with me on his own terms. The sensory-based relational art therapy approach, or SBRATA, can be used by caregivers and professionals, not just working with children on the spectrum, but with children with any kind of developmental and psycho-emotional issues, children who have high anxiety and may not be open to communication.